We begin tonight at the White House, where President Donald Trump held a press conference focused on autism. During his remarks, he suggested a possible link between the use of acetaminophen during pregnancy and an increased risk of autism in children. Today, I spoke with the co-author of a study published last month in the journal Environmental Health. Now, the research linked prenatal use of acetaminophen to an increased incidence of disorders from autism and ADHD. But today, Dr. Bauer stressed to me that the link she found requires a lot more research.
The risks that we identified were modest, particularly for short-term use. When we see the highest risk is for people who use it for an extended period of time. So I don't think that mothers should get hysterical if they're pregnant and have used it for a day or here or there. But they should not be using it as the first line of defense of any minor discomfort that they experience. They should be trying to use non-pharmaceutical interventions first. But it has its time and its place. While we strongly support precaution and warning pregnant women about the use of acetaminophen during pregnancy for things like nuisance pain and mild discomfort, acetaminophen is really one of the only tools we have for pregnant women. They are not allowed to use ibuprofen or aspirin during pregnancy. And things like high fever and extreme pain can cause severe outcomes and harm fetal development. Now, there should be a discussion between a woman and her physician before she takes it. But I think doctors are afraid to have even mentioned this in the past because they don't want to lose this tool in their toolbox. And it's a very nuanced statement that sometimes you still will need to use this medication.
Now, also during that press conference with President Trump and his top health advisors, he said that he's a big believer in vaccines. But today he also claimed, without citing concrete evidence, that giving vaccines close together at the recommended ages could also be linked to autism. So I also asked Dr. Bauer for her reaction on that. Take a listen.
The question about vaccines and autism has been asked and answered. There have been between 20 and 30 case control studies and cohort studies, and we've never seen a signal. This question has been asked and answered. It's been the vaccine link has been debunked. I don't understand exactly why he's gone there. I know Robert Kennedy thinks otherwise, but the science says there's no link.
All right, I want to bring in Dr. Veronica Gillispie-Bell, Vice Chair on the Committee for Practicing Guidelines for the American College of Obstetricians and Gynecologists. Dr. Gillispie-Bell, thank you for being with us. What does the ACOG have to say about the use of acetaminophen during pregnancy?
So ACOG maintains that Tylenol or acetaminophen is safe in pregnancy when it is used as directed. As always, we want our patients to consult with their healthcare provider before using any medications, but all of the data shows that it's safe, and there is no data that shows Tylenol causes autism.
So President Trump also said there's no reason to vaccinate newborns against hepatitis B, saying this is a sexually transmitted disease. So why is that vaccine part of the current vaccine schedule for babies and newborns?
So actually, the highest rate of transmission is from mothers transmitting it to their babies during birth. And so that is the reason that we give the vaccine. We do try to test moms for hepatitis B to see if they are carrying the antigen, but really the best treatment or the best prevention for babies is to provide that vaccination.
And are there any serious side effects that newborns have experienced from having the hepatitis B vaccine so early in their life, almost right after birth?
There's no data that shows that there's any side effects or any long-term consequences of providing the vaccine at that point.
I can only imagine how difficult it would be for a pregnant woman right now who's getting all of this information. And as somebody who has had 2 babies, it's a very emotional time. It can be a very scary time, and you want to do what's best for your baby's health and also your own health. And there's a lot of fear and mistrust of medicine right now because of all this conflicting information. How can doctors help patients navigate these confusing health guidelines like these are?
Yes, I know it has to be very confusing to our parents, to our moms out there, to their family members that are loving them and supporting them with all of this data coming out. Really, we want our patients to always seek their advice from their healthcare provider, and we really want providers to rely on the science. And again, the American College of Obstetricians and Gynecologists, as well as the Society of Maternal Fetal Medicine, has released guidance and recommendations to remind us that all of the data shows that Tylenol is safe in pregnancy. It does not cause autism. And we have to remember, we're usually recommending Tylenol for conditions like fever. As was stated earlier, we don't have an alternative medication for treating fever. And we know that when someone has fever and it's not treated, especially in the first trimester, that can lead to birth defects. And so we really want our patients to rely on our providers, and we want our providers to rely on the recommendations from ACOG and the Society of Maternal Fetal Medicine.
You know, RFK Jr. and Donald Trump both said that their goal was by September to have some real information on what causes autism. Autism has been studied for many, many decades. Have doctors really come to any kind of conclusion of what causes autism and why it seems like more children are developing the condition?
So we all would love to find the answer for what is causing autism. One of the concerns, one of the issues is that it's multifactorial. It's neurodevelopment. It comes from neurodevelopment, and there are multiple factors that contribute to that. So that makes it really difficult to find the one thing that causes autism. And yes, the rates of autism have increased, but also so have our ability to detect autism and our ability to recognize it and test. And so it's hard, it's difficult to say, are we having more cases because there are more cases, or are we having more cases because we are redefining and we're doing a better job of diagnosing and starting treatment early?
Are you concerned? The president said that there's going to be a warning label placed on acetaminophen and Tylenol, saying that there could be a link between using this in pregnancy and autism. Does that concern you or worry you that there might be pregnant women out there that may have a high fever or extreme pain that would be nervous to take anything?
Yes, I am very concerned. When you see that on a label as a pregnant mom, as you said, we all are trying to do what's best for our babies. And so I think it will make our moms scared to take Tylenol, and the repercussions, again, for those moms that are having fever and those moms that are having pain, those repercussions can be very detrimental. And it's really shameful when we know that Tylenol is safe. And again, we have no studies showing that it causes autism.
Dr. Veronica Gillispie-Bell, thank you so much. Great to see you.
Thank you. My pleasure.